Hi guys, I'm Dr. Namrita and I practice in Bangalore. Many of my friends were asking this COVID-19 season being a bit very confusing to everybody. Should we practice or not? Being a dentist, especially a prosthodontist, I took a decision that I will not be practicing not a full-fledged dentistry till at least September or maybe if required December end. Now if you ask me why, am I not prepared mentally to do that? Am I not equipped to do that? No, that's not the answer. I am equipped. I am, yes, mentally not prepared still. Actually, last week I did go. I did treat a case fully, donning that astronaut suit, a PPE, what we call. But then, trust me, I wasn't comfortable. Dentistry being such an intricate job that we need to concentrate a lot, first. Secondly, we are just focusing on one area, which is a small area, and we require a real concentration to work there. That can be only possible when we are free of all the tortures which we are going in our body, within our body, and externally. With the PPE on, what I felt was we can't concentrate. We are trying to settle ourselves first, and when we are doing that, getting into the mouth and doing things was not easy, and it was really very disturbing for me mentally. And I feel whoever is in my place or whoever dons a PPE will vouch on this fact that it's not comfortable to work like that. Now what does that mean, that not comfortable? Maybe we might get used to, maybe you might get used to, but I don't want to get used to that at all, because it's not easy. It's like you having the hood and you're trying to work, and you're sweating. It is just like you get out of the sauna after 5 to 6 minutes. You imagine what is the sweat you're undergoing. So you imagine you having that PPE and you can't sustain that PPE for more than maybe 2 hours at a stretch. And if we assume that in 2 hours we can finish quite a bit of job, no, it's not possible. Because the protocol says you have to have in between 2 patients some time. You need to fumigate the clinic, post a patient, and then enter the clinic after some 20 minutes, 30 minutes. And in the process, what are you doing? You can't don and doff the PPE every time you are doing these procedures. So ruled out as aerosols. Secondly, forget doing any other work with micromotor. It's gonna take long. Thirdly, you're doing an extraction. By chance, the tooth broke. What next? So there's lots of questions, and now it's going to be a real enigma as to how to practice dentistry. Not easy. So let us take it easy. Now, if at all you still feel, no, I can do it, this is nothing, then if you are, actually what I actually want to say here is, if you are psychologically, physiologically and physically fit, then think of it. Okay, what do you mean by psychologically fit? See, for me, I did PPE, I came back home, I still was not relaxed mentally that I'm fine, I'm not contracted anything. If you feel you will also have this sort of a symptom of coming home and saying, did I see a COVID-19 positive patient or symptomatic, asymptomatic patient? Am I very mentally clear? Nothing happens to me, then it's fine. But for me, I was lots of in dilemma as to who was the patient I saw. Irrespective of the consent form signed, irrespective of the history taken, the temperature checked, and whatever done, still I had that in my mind. I hope I'm safe. So psychologically, if you are, yes, nothing is going to affect me and I have done it perfect, and I can go home, relax, be with my family the way I have to be, and you enjoy, then that is, you have won the game of psychology. So psychologically you are fit. Now what is physiologically? Are you fit enough body wise that you're a healthy individual, that you have a good immunity and you can go and fight it out there? Then yes, you are a case. If you don't have any comorbid conditions, or you're not above 60 and you're still feeling I can do it and you're still confident on yourself, go ahead. Physically, as in, is your clinic well equipped? in all forms to combat this particular condition? Well, my clinic was good enough and that status where I could combat HIV, hepatitis B. So this is nothing for me? No. I also thought the same. But COVID is something different. We are where it is in the major concentration, that's the mouth, that's the saliva, and it's been found by research that ACE receptors are too many in salivary glands and especially the small mucus glands in the mouth. And we all know that this ACE2 receptors, when they are so many and then COVID-19 is there in the major concentration, the virulent factor is high. So it's not easy. One leakage of your mask somewhere, your inhalation, your aerosol can create lots of problems. So when I say well equipped, that is what I mean. You have the best of PPE, you have best of coverage, and you feel yes, there is no leakage and I'm all confident. Again, I'm using the word. When you're all confident that nothing can come and affect me, and then post procedure, if you feel you can fumigate the clinic to that perfection and you are practicing a beautiful protocols of having a patient post 60 minutes and whatever. You have planned everything physically to set right to that particular level and you are damn confident that yes, I can do it and I'll come back home confidently. Then alone you can go ahead and practice. So that means to say physiologically, psychologically, physically, when you're all well equipped and you feel I can do it, then please go ahead. Do it with conviction, do it with confidence. Don't come home confused. So if you can achieve these protocols, then please go ahead and practice. Otherwise, relax, stay home, stay safe. That is my small message for you guys. I hope it helps in making decision. Thank you.